Welcome to the bonus content for the medial tibial stress syndrome episode. In this content, what we're going to do is we're going to talk about some special tests that can be used to differentiate between MTSS and stress fracture, and also give you a special test that can help identify a dysfunction that may predispose an athlete to MTSS. We'll also talk about some taping techniques that I've used to help with medial tibial pain. And then we'll also talk about an exercise that can help strengthen the posterior tibialis muscle. All right, so what we'll do is we'll start with our evaluation. So the first test I want to go over is the fulcrum test. If you go back into one of our past education episodes, particularly the stress fracture episode, we talk about the fulcrum test being a great special test to help identify stress fractures. So we're including it in this bonus content because one of the differentials of MTSS is you want to make sure you're not dealing with a stress fracture. So how the fulcrum test is described, you basically just try and bend the bone. Sounds kind of weird to say, but you essentially create a fulcrum. And how the test is described is you use your fist and then you just push down. A positive would be pain over the area that you're suspecting of a stress fracture. So in this case, it'd be kind of like the top of her tibia around the distal 1/3. You just put pressure, kind of creating that fulcrum. From what I've noticed is this kind of like there's a lot of movement, the knees moving. Like I don't feel like I'm really getting enough bend to the bone. So what I'll do is I'll kind of modify and I'll have my leg under her calf, and then I literally just try and bend the bone that way. I found that I get a pretty good fulcrum that way. Some people, like I'll ask them when I have them here, I'll be like, oh, do you have any pain? And they'll say, yeah. It's pretty good to indicate like, oh, where do you have that pain? Because if they're having it on top, you can probably feel pretty good that, oh, I might be dealing with a stress fracture. Or if they're like, oh, it's in my calf, well, that's basically because we created basically like a foam roller as we're pushing down. So any pain in the calf, I feel a little bit better about not being a stress fracture. I've also kind of changed the way I do fulcrum as well, because when you talk about MTSS, a lot of times you get that medial pain, and it is possible to also have stress fractures along that medial tibia. So doing a normal fulcrum where you're just here doing one plane doesn't give you quite that medial side. So what I've done is I actually create a fulcrum this way, and I'll actually kind of bend it, like adding a medial force, trying to bend down that inside. And I found some pretty good results with that as well. For suspected stress fractures, they'll have pain in that one spot as I fulcrum that way. So the next test I want to go over is the navicular drop test. So listening to our MTSS episode, we talk about how increased foot pronation or an increased duration of foot pronation could be a risk factor for MTSS. It definitely, the research definitely kind of supports it retrospectively, but in prospective studies, we're still waiting on that literature to really fully back it up. But this is a great test to identify if that's a dysfunction that one of your patients has. So for the navicular drop test, what you'll do is you have them start seated first, and what you'll do is you'll identify where their subtalar neutral is. To do this, you just have them invert and evert. So, first you'll palpate where the talar dome will be. Then you have them invert, and then evert a little bit. Invert a little bit more. Right there. A little less. And what you're trying to feel for is when the talus is about equally palpable on both your finger and your thumb. So the medial and lateral sides you can palpate about the same, feeling the same amount of pressure. You'll make a mark where navicular tuberosity is. Once you make that mark, what you'll have, you take a measurement there from the distance from the ground, so you would have like a note card. You make that measurement, and then what you'll have them do is go ahead and stand on up. And then what you do is you measure that distance from the start, and then you take another measurement right here where navicular tuberosity is, and see what that difference is. Go ahead and have a seat. In general, the difference shouldn't approach 2 centimeters. If it's around 1.5, 1.8, that's around normal. Anything above that could be indicating that they have increased pronation or increased flexibility of that midfoot. So now that we went over some special tests that you can use when evaluating someone with MTSS or what you think may have MTSS or stress fracture, now time to talk about like some taping interventions that you can do to help the athlete compete or practice with limited pain. One tape that I like to do is something that's a little more rigid. A lot of people already know about the white tape where you just go around in circles. The problem with that is a lot of times it puts a lot of pressure on the calf. You can get some people that cramp or just don't like the feeling. One way that I like to attack taping for those MTSS patients is kind of attacking what some people have theorized to be the cause of MTSS, and that's the tension coming from posterior tib, from the soleus, flexor hallucis longus, like all these different muscles on that medial side, trying to attack that source and take pressure off of there, and hopefully that would alleviate symptoms. I found some pretty good success with this, especially in my runners, which I've been very proud of. So what I'll do is obviously I'll do some tough skin or adhesive spray, and then I put them in just slight inversion. And then I like to go straight to the skin for this one. Obviously, there's some people who, if they have allergies or if they don't like this tape will irritate their skin, I can go with a layer of stretch tape. I try not to do the pre-wrap just because it just kind of is flimsy and it'll just come right off. So if anything, I'll do the stretch tape as the anchor. And what I'll do is I go on that medial side, just kind of where all those deep plantar flexors are, like the tibialis posterior, and then the flexor digitorum longus, flexor hallucis longus, and I add a little tension, and I basically just come around. Essentially what we're trying to do is kind of support that medial side, helping that musculature to keep them there so when they're stepping, they have some support instead of getting that overpronation with putting pressure on the muscle. A lot of times I will go 2. So I'll go 2 strips. And I just kind of same thing, kind of overlap them a little bit, not directly over each of them. Add some tension and come around just like that. If your tape's starting to go, like the adhesive's not as strong as it used to be, you can add stretch tape here to kind of hold it in. But I haven't had any issues just going like this, and then they're good to go. So that's more of kind of a rigid tape style if you're trying to tape someone who may have MTSS. There's also a study that looked at utilizing KT tape. Now, everyone has their beliefs on KT tape, what it does, what it doesn't do, but what was interesting about the article that examined KT tape and foot pronation was they actually used it for motor control and kind of motor retraining, motor relearning. And what they did was they took people that had increased medial longitudinal arch pressure, and they applied this tape, kept it on for about a day, and then actually the next day when they tested them, they actually started to see that their pressure started to shift more laterally. So essentially training them to get out of that pronation. And it's very similar to the rigid tape that I just did. For the tape, how they did it in the study is they did split it in 2. What I've noticed is splitting it in 2 does make it a little bit easier to come around the malleolus, and the tape sticks a little bit better. So same thing with that rigid tape. I basically have my base right around up there. And then what I'll have them do is slight inversion. And then just same thing like I did with the rigid tape, just slight tension. And come around.
This KT tape's really old.
Yeah, no judgments here. So there's the first one. And then the second one, same thing.
So is this kind of mimicking post-tib, like towards that cuboid?
Exactly. Essentially it follows mostly the muscle path of the tibialis posterior, just how it follows along, and then it'll actually come around under the arch, going across that cuboid, and you get a little bit over it. But essentially it follows what tibialis posterior would run. So essentially you're really trying to stabilize that tibialis posterior, which is so vital to support of the arch and control of the foot just in general.
And something as simpler as a navicular strap could That's usually what I start off with.
Absolutely. A low dye arch tape or any really arch tape that helps prevent that navicular from dropping has been shown to be successful as well. I know some people are hit or miss about it. That's why a lot of times for some of my MTSS kids, I'll pretty much go that route. But yes, absolutely, treating for that navicular drop or some kind of arch tape has been effective as well. So now that we talked about like some taping applications, now we want to really talk about how are we going to rehabilitate this injury. If you go back into our plantar fasciitis episode and look at the bonus content there, we talked about toe yoga, the short foot exercise, basically really strengthening those intrinsic foot muscles. I encourage you to go back and watch that or listen to that episode because a lot of those concepts can be applied to here. Because with MTSS, control of the arch is very vital because if you don't have control of that arch, it puts a lot of tension on those extrinsic foot muscles like tibialis posterior, flexor hallucis longus, flexor digitorum longus, and the soleus itself as well. So one thing that you can do is early on, it may be pretty tough to strengthen that posterior tib just because of pain, depending on how painful they are. They may not want to be activating too much just because of the tension, whether it's coming from the theory of the traction theory or the overuse bony injury. Any type of trauma there, if you're pulling on that bone, is still probably going to cause pain. So something that you can do a little bit later as their pain's going down, you can do a calf raise with the band around their ankles, or maybe even just a little bit above their ankles. What the band does is it essentially tries to push them into that eversion and try to put a lot of pronation and really stress that side. So to counter the band, what you have to do is kind of give a little inversion force. So what I like to do when I have athletes do this is they'll do a calf raise, but when they do the calf raise, I don't want them going all the way out to their, fifth, fourth metatarsal or that fifth, fourth phalange. So what I'll do is I still have them center their pressure around the second and third toe. So they're still getting some force without overly doing it.
I also feel this in my glutes.
That's always a plus too. Which glutes do have a very big component when we're talking about medial tibial stress pain, as like what we talked about in the stress fracture episode. So hopefully this bonus content kind of gives you some ideas when you're evaluating someone with shin pain to help think about how do I differentiate between MTSS or stress fracture, or if I am seeing someone with MTSS, what dysfunctions do they have that I can attack? With the taping application, hopefully this gives you an idea of what interventions can I do to help decrease pain while the athlete is still competing. I know sometimes with athletics, it's kind of hard to just shut them down, even though rest has been shown to be the best thing for MTSS. Sometimes that's kind of a hard deal to swallow as they're competing. Maybe it's postseason time. There are a lot of factors that kind of go into that decision. So hopefully these interventions kind of give you an idea of what can we do to help minimize that pain. And then hopefully the rehab exercise is just another tool that you can think about as you're structuring someone's rehab.